Good evening. Diabetes is a serious chronic condition affecting the lives of many Canadians. Take the example of Shelley Huang, only 12 years old and already a diabetic. What's the Ontario government doing for people like Shelley? And what could be improved? David Nye brings you her story.
Little Shelley Huang was diagnosed with type 1 diabetes when she visited her doctor a year ago.
I remember when I was first told I was diabetic. I was so scared.
Shelley is not alone. Today, about 1.2 million Ontarians live with diabetes, and this number is expected to grow. Currently, there is the Ontario Diabetes Strategy, ODS for short. It is a $741 million plan aimed at preventing, managing, and treating diabetes across the province. Some targets include ensuring access to a primary health care provider for diabetes patients, providing access to insulin pumps, and increasing the number of annual bariatric surgeries. But many experts say that the Ontario government has not done enough to support diabetes management. Dr. Michael Wilson, a health policy professor at McMaster University, discusses a new policy option put forward by the McMaster Health Forum.
So we're looking at how to optimize supports for diabetes care. And one of those options that we've been discussing at the McMaster Health Forum is looking at how do we support self-management for people living with diabetes, but then also supporting the decisions made by the healthcare providers themselves. So the self-management really involves providing them with self-managed patient records, peer support, and other ways to manage their care with their family. But then also with the decision support side, it's how do we get healthcare providers to use clinical practice guidelines, and what are some of those strategies to make them available and easy to implement in their practice.
Dr. Wilson says that the policy has a high chance of being implemented when Ontario's public institutions are considered.
It is inconceivable who could possibly oppose this policy option.
The Ontario government has been very supportive of the work already initiated by the Ontario Diabetes Strategy. Their continued support can be expected with a strong Liberal majority led by long-standing Premier Dalton McGuinty. It can also be seen that Ontarian physicians would jump on board the diabetes bandwagon, since they stand to benefit the most with respect to increased autonomy from increased decision support.
Approval from Ontario's doctors is crucial given their privileged place in policymaking.
When we took the policy option to the streets, this is what people had to say.
Yeah, my dad has type 2 diabetes, and I can see how increased patient self-management is a good thing. Yeah, I like the idea.
Yeah, whatever makes the system more efficient, I guess.
Improving diabetes care is important, but what about prevention?
If the policy option is as well received as the ODS, all indications are that the implementation of this policy will be a great hit amongst those afflicted by diabetes, physicians, diabetes experts, and advocates.
We have the evidence to back up that this policy option will work.
Key systematic reviews support the use of home glucose records, web-based tools, and financial incentives for both patients and clinicians. Evidence also supports the province's e-health strategy for an online diabetes registry accessible for both patients and physicians. There seems to be one element and one major interest group missing in this big picture. The Canadian Diabetes Association, or CDA for short, is an advocacy group for persons living with diabetes. The CDA was supportive of the ODS initiative, but have repeatedly voiced a missing piece of the jigsaw puzzle that is in Ontario's diabetes plan. We had an opportunity to talk to Richard Wu, a representative of the CDA.
I think the Ministry of Health is too focused on therapeutic care. Preventive medicine is something that is definitely lacking in Ontario's diabetes care strategy, and we at the CDA were very surprised actually when the Ontario government did not give it more consideration back then when they were drafting the ODS. If there are going to be future policy changes, we strongly urge the government to do two things. One, have consultative discussion with the diabetes community and other relevant stakeholders, and two, make prevention a priority.
Despite these limitations, there's a high chance that this policy on diabetes management will be passed by the Ontario government because of the strong support from doctors, government institutions, and positive feedback from the ODS. We must not forget that an effective diabetes plan is integral to the health of many Ontarians, like Shelley, that are affected by this chronic illness. This is David Nye for the McMaster Times reporting.
Thank you, David. In our next story, we'll take a look at the earthquake in Japan.